So the second paper in this session is Characterizing Trajectories of Work, Disability, and Health in Work and Retirement Multi-State Analysis. We have a lot of trajectories coming up in these. Oh, I'm sorry. Yes, Amal Harrati will be the presenter, and then Courtney Coyle will be the discussant.
Thank you all. Thanks to NBER and SSA for allowing me to be here and also for funding this work. This is joint work with Mark Cullen, my PI at Stanford, who's sitting here, as well as Peter Hepburn, who's at UC Berkeley. I am a demographer by training, and so the approach that we've taken for this work is one that uses some demographic methods, so hopefully this will be a little bit novel to at least some of you. And then the sort of caveat I'll make here is that we are still waiting for SSA data linkages to actually look at retirement, so this will be much more about the sort of work-life portion of this and less about the retirement portion, but I'll try to sort of tease up what we plan to do once that linkage comes, which should be soon. So we have two main aims for this paper. The first is to characterize common trajectories between work and disability in a cohort of workers. And the second is to identify differences in these trajectories across sociodemographics, some job characteristics, and health status. So the sort of big questions here, we're asking what are common trajectories of work and disability across a work life, and then how those trajectories may differ by these characteristics. Again, I'm sort of preaching to the choir here. I don't think I need to tell many of you, but as we have seen, life expectancy has increased, but the age of retirement largely has not. What we have also seen is a large increase in federal disability claims. This has historically been the case at older ages, but what we see more and more are secular trends across the entire age group, which I think points to something about working conditions or other things that are affecting a broader age range. And so that's sort of part of what's motivating this work. And then, of course, we know that disability claims are closely tied to early retirement decisions as well. We know that transitions into both short and long-term disability are associated with a variety of negative consequences. Those include loss of lifetime earnings, increases in medical costs, also some sort of psychosocial problems such as psychological distress and family disruption. What we don't really know, so we know sort of something about the individual level impacts of transitions into and out of short-term and long-term disability. What we don't really know much about are the mechanisms of those transitions. And the reason we don't really know much about them is in order to understand those, we really need to be able to follow workers over a long period of time at a very sort of finite or minute level of detail in order to understand how these transitions are happening. And largely, at least in the US, we don't have good data to be able to do that. There is some good data that comes out of Northern Europe and Scandinavia with the registry data, but in the US, that data has largely been missing. And so here I'd like to introduce a data that we have at Stanford that we find to be pretty novel. This is work that Mark started a number of years ago when he was still at Yale and is now part of the Stanford. So this is sort of a private-public collaboration that we have with Alcoa. Alcoa is a large aluminum manufacturing company. This is a relationship that has now gone more than 15 years. And at the core of this relationship is our sort of ownership of the HR records. And so what we have essentially for all of the workers that have ever been employed at Alcoa for every day is whether or not they are working, and if they're not at work, why they're not working. And then, of course, over the years, the data has sort of grown arms and legs. And so we have a variety of sort of workplace safety and environment. We have some financial information and some health. I've highlighted the parts of this that we will be using for this project. So medical claims files have all of the health data in them. We have, obviously, the disability claims. So again, these are Alcoa specific. This is work disability. And then some additional health records. We have a number of hours, W-2s, and that sort of thing. And then we also have a job demand survey. So we have some information on pollutants and sort of occupational exposure, as well as physical demand, heat, and some psychosocial questions about work. We have kind of a two-part empirical strategy. We start with the human resources data. Again, this is data that we have on every person who's ever been employed at Alcoa for every day. We use the time period between January 1996 and December of 2013. We aggregate up to monthly data, just for the sake of kind of getting our hands around things. And then we assign every worker during that time period one of 6 states. They are either regular work, short-term disability, long-term disability, on leave, they've left Alcoa, or retire, and I'll sort of caveat retire for a second. So regular work is what you would imagine it to be. Short-term disability, again, is Alcoa-specific short-term disability. Long-term disability is the same. You do have to go through short-term disability in order to be on long-term disability at Alcoa. On leave captures everything else, so that can be union leave, military leave, FMLA, or maternity leave. Leaving Alcoa then is sort of obvious. And then, so again, the retirement piece, what we hope to do eventually is link our working population with SSA so we can actually see actual retirement behavior. What we have for now as a proxy is one of 2 things. Self-reported retirement, so when people leave, they will sometimes state that they retire. Many of these workers also have a pension, and so the other way in which we've coded retirement is if one has left Alcoa and they're either partially or full eligible for pension, we code those as retirement. But I will say, sort of the distribution of number of people that are retired based on what we'd expect is much lower. So we do think that we're not accurately capturing, fully accurately capturing the retirement based on the way we're doing this, and are looking forward to the SSA linkage. So we end up with a sample of 49,529 workers, and then with every month we end up with over 10 million worker time observations. So you can sort of imagine a data set in which you've got 49,000 rows, and then 18 years times 12 months, and then at every cell we just have one of the 6 states. Every person is assigned one of those 6 states. So the next thing we do to actually build these trajectories is to use sequence analysis and cluster analysis. So for those of you who know what that is, the sequence analysis essentially takes all those states per individual and creates trajectories. The technique we use there is optimal distance matching. And then the cluster analysis essentially takes those 49,000 rows and creates groupings of workers that are more or less similar based on their trajectories. And there we end up with a silhouette width of 0.72. A sort of good silhouette width is usually considered something about 0.65, sort of a metric. And then the last step to do is we take multinomial logit models, and we just look at associations between person-level, job, and plant-level characteristics. So just to give you a state, sort of these the way we think about these as multi-states, these are the different states here, the 6 different states. You can see that you can move in and out of a number of states. Retirement, once it gets coded by SSA, will be a terminal state. So once people retire, they can't come back. But other than that, you do see both kind of theoretically and empirically movement between states. To give a sense of the cohort characteristics, this is a manufacturing firm, so the sample is overwhelmingly white and overwhelmingly male, but we do see almost 20% of women in the workforce. Alcoans are not poor, so if you imagine that many of them live in parts of the country in which the cost of living is relatively affordable, the median income is $53,000. And then I want to just point out one of our measures of risk. So we do have hospitalization measures, which we see with the chronic disease. We also have a measure called a risk score. That's a sort of algorithm that is created. It's based, again, because we have administrative data, it's based on the total expenditures, medical expenditures from the year prior. So just to be very specific, it's really a measure of health-seeking behavior or health expenditure, not of actual health. But we have done a bunch of work to sort of corroborate this with hospitalizations and find that it's a very good sort of aggregate measure for total health for this population. So here are the clusters. We identify a number of sort of sequences, and then I've kind of further grouped those into what I'm calling typology, just for the sake of simplicity. So we have 3 clusters of workers that represent about 64% of the working population that I'm identifying as continuous work. These are people that mostly just show up to work every day, don't really have much in terms of major disruption to their work, and then either terminate or retire. There are another 3 clusters that I'm sort of grouping at what we call minor STDs. So these are workers that maybe have one STD event and then either go back to work and terminate, or maybe have a second STD event as well. And then two different working populations, and this represents 8% of the sample of what we call disruptive. So as you can see by these are workers that have a number of disability transitions in and out. Some of these end up in long-term disability, some go back to work and get censored. And then finally, given that the numbers are small, we group everybody who ends up on a long-term disability into one group, which we call EVER-LTD. We do have there's sort of, I think, some interesting stuff in the LTD group. It is small. There are about 500 workers that end up on LTD, so we do have some work looking at that separately, but I won't talk about that today. And then this is just to sort of give a sense of the mean amount of time. So this is the entire panel, so from the time period of January 96 through December of 2013, to just show how much time on average in months workers are spending in these different states based on these 4 typologies. And finally, I will sort of skip some of the dense tables and instead just sort of wanted to show the demographics in a more schematic way. So again, I'm sort of looking at the 4 different typologies. These are all relative to the continuous work group. And looking at age, tenure, whether or not people are hourly or salary, whether they're male, and then health as measured by this risk score. And we see sort of what one would expect. So the age increases relative to continuous work for the STD and LTD groups. The health follows very much the gradient that one might expect. So with increasing sort of severity in terms of disability, we see higher health risk scores. So moving to the second part of this, we wanted to explore the extent to which the demographic, health, and job-related characteristics are associated with cluster membership. So here we ran a multinomial logit model. We compared continuous work as, I'm sorry, this is sort of dense and small, but I'll walk you through it. So the reference category here is continuous work, and we're comparing 2 other typologies, the short-term disability group and then the disruptive group, these 2 clusters that had a lot of transitions. We're leaving out the LTD, again, just because the sample sizes are so small that it was very noisy. So this chart will grow these are odds ratios because it is a multinomial model. This is one full model, so this is not stepwise. I'm sort of going to show this schematically stepwise just for the sake of kind of taking it all in, but this is one full model. And then, of course, the bar at 1 is just the odds ratio of 1. So anything we see over 1 are things we might expect. And I'm sort of highlighting this in terms of job characteristics, health, and then individual characteristics. So I think that the 2 things that really stick out here is huge gender effects. We, for a long time, thought this might be related to maternity leave or other things, but we've sort of cleared all of that out and are pretty sure this really is just a sex effect. So I think the women who work in these kinds of jobs are quite a select group. I think there's much to learn from them. And then, of course, union status, which may not be surprising, that allows the protection to go on and off short-term and long-term disability with greater ease. We looked some at health. So again, here we have a number of chronic diseases. These are measured by total hospitalizations, both inpatient and outpatient, as well as this aggregate measure of risk score. And we do see, again, this sort of health gradient. So big effects for musculoskeletal. That's not surprising for anybody who's done work in this kind of these kinds of populations. But we also see some important things with ischemic heart disease, which we see again in other studies looking at Alcoa. Depression, especially in the disruptive work, is quite interesting. And then, of course, the aggregate risk score also seems to matter. And then, so these are total particulate matters. So this is basically the junk that's in the air that you breathe in when you work in sort of heavy manufacturing. We have both the annual, so we have quartiles here. We have both the annual measures of total particulate matter, and then the cumulative measures of total particulate matter. And again, so especially with the disruptive work in the 4th quantile, we see just enormous effect sizes. So, the kind of thing we really had to scratch at for a long time to make sure that this was the case. So the distribution on TPM is very highly skewed. But certainly for some that are working in very sort of difficult physical environments in this job, we see big relationships with disability, and we suspect would probably see relationships with retirement decisions and early retirement decisions as well. So to conclude, there are a number of disparate work and disability transitions and trajectories. Some, at least in my mind, appear to be very disruptive. There are differences that exist across a number of demographic and health conditions. Physical occupational exposures are strongly associated with disruptive job trajectories. We saw almost nothing as it related to psychosocial demand. There didn't seem to be much there in terms of transitions to disability. And then the one thing I will say, Alcoa is, of course, one company in a specific industry, but there are well over 40% of US workers that have jobs that require some physical demand. So we do think that these kinds of things are more generalizable. And then I will just end by talking quickly about the next steps. We do have some plans to do some event history analysis so we can look at the timing in and out of these transitions. And then, of course, the sort of key question here, which we have not yet been able to answer, is the extent to which these trajectories lead workers into different patterns as it relates to retirement retirement decisions.
Thank you.
Thank you.